Okay, so I'm going to walk you guys through how to take a blood pressure. First and foremost, I have wiped down my ear, okay, my earbuds on my stethoscope as well as my diaphragm. I have also inspected my blood pressure cuff, okay, making sure it's the right size, there's no rips or tears in the tubing, um, understanding the design of it, so I'm familiar with how to release the air of the cuff itself. Some of the designs, as I mentioned, this one is a trigger. Some of the designs are actually meant with a screw mechanism. Okay, it's a slow screw mechanism. Okay, so again, we want the patient to be relaxed. Okay, all right. We most inevitably will be working around the patient, but we need that arm relaxed. We need them sort of just to let that arm go limp type of thing. Once I've identified it's the correct patient and all of those particular details, then what I'm going to do is I'm going to, just above the antecubital fossa, I'm going to be looking for placing that artery index marker along that brachial artery. Now, it's important that the cuff itself is applied correctly. And to apply it correctly, what I'm referring to is that the cuff can't be too loose or it can't be too tight. Or you become, what happens is that you get an inaccurate reading. Okay, if it's too loose and you start to pump it up, well, it's going to be a lower blood pressure. If it's too tight, then we start to sort of experience more higher blood pressures than are typical. So the arm of the sleeve would be up along the patient. This would be nice and snugly. And this is kind of a type of thing where you do at times get quite close to the patient. Okay. This now, with the patient's arm relaxed and the cuff applied nice and properly and tight, what I'm going to do is I'm going to let the patient know that as I pump the cuff up, I'm going to get them to relax. They might, you can sometimes get what we consider sort of a little bit of a numbness or tingling in the bottom of the hand here type of thing. We try when we are releasing the air from the blood pressure cuff itself, we try to do it in a very controlled and purposeful and paceful manner. If we're too slow, then the accuracy on the needle cannot be correct, as well as to we can cause some pain and discomfort to the patient, particularly distal to where that blood pressure cuff is. Okay, all right. So if I have my earbuds in, what I want to do is I want to take the diaphragm and I'd like to place it so it should be just actually placed in a tight manner. It's hard to talk in a very acoustic. So we place it just underneath the cuff itself, right over where the location of that brachial artery is. Okay, this is where you almost sort of feel like you have to be an octopus. Like it'd be helpful to have 8 arms in this case, but this is why it's all about practice and technique. Okay, so I'm looking at my needle. I've engaged my my blood pressure cuff itself. I start pumping up. Now, again, when I'm pumping up, what I'm going to be doing is I'm going to be listening, and I'm also going to be watching the needle. When I get to about 80 milligrams of mercury, so I pumped it up. Now, I'm not going to get necessarily an accurate reading on this individual. When I've pumped it up to about 80 milligrams of mercury, I'm going to make sure that my stethoscope, the diaphragm of my stethoscope, is placed directly over top of that brachial artery. You'll hear the brachial artery much better at about 80 milligrams. Okay, so we do encourage you to pump it up to about 80 to begin with. Make sure you are over top of that brachial artery. Now we're going to continue to pump it up. Okay, we pump it up to about 130. Okay, maybe even a little 150 to begin with. And then what we're going to do is, as we release the needle, we are going to be looking for a couple of things. We're going to be looking for the systolic pressure, where the needle, the gauge of the needle, is going to be quite evident how it flicks. So as we're slowly and controlling moving that needle down on the gauge here, also we're going to get to the systolic pressure, and it's going to go flick, flick, flick. So along that number, where that initial flick took place, is your systolic pressure. Okay, that's where the heart contracts. Now, this is why we don't want to go too slow, because if I'm going super slow, it's not as evident that needle's going to flick. So it has to be in a manner, like it's nice and smooth as you do this, and then it'll go flick, flick. That's your systolic pressure. When the needle is continuing to go down, then you will see that the needle sort of stops flickering, and that's your diastolic pressure. That one's a little bit harder to actually see. Okay, that's where the heart muscle relaxes. Okay, your systolic is when the heart pumps and contracts. Diastolic is when it relaxes or is at resting state. So the needle, as you're watching and it's coming down, will go flick, flick systolic, and it'll keep flicking, and then sort of stop flicking. That's your diastolic. What we say is that you have to hear as well as see this blood pressure. So what we're going to ask you to do is when you're listening to the blood pressure, initially, as we hit that systolic pressure going, it'll go boom, 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 boom. So you'll see it and you'll hear it. Then as we get to the diastolic pressure, where it's less obvious with the needle flick, what you will hear is a whoosh. So we go boom, boom, whoosh. Okay, boom, boom, whoosh is what you will hear when you take the patient's blood pressure. Okay, and again too, it's just, move around the patient, get yourself comfortable, allow yourself to find out where it is that you can, look and manage this, because if that patient's arm is suspended, that muscle contracts, and then that's going to have an influence on there. Okay, make sure you pump it up to about 80 milligrams of mercury. So you have that brachial artery placed right over there. You'll right over the diaphragm of the stethoscope, and you'll be able to hear it, and then we'll be good to go. And then we will talk about how to record the systolic and diastolic blood pressure in lecture and at your PowerPoints and stuff like that. Okay, all right, you guys, there you go.